June is National Cancer Survivor Month, so here on Your Life, Arizona, we feel like it's a good time to not only celebrate survivors and their victories, but also talk about prevention. Dr. Gina Tazi is from the Dignity Health Cancer Institute at St. Joseph's Hospital. Dr. Tazi, good morning. Great to see you.
Good morning. Great to see you too.
You and I were talking about the typical doctor-patient relationship and how you really go beyond that. So I have to tell you, as somebody who lost a loved one to cancer, I appreciate your role at Dignity. Can you share with everybody exactly what it is that you do? Because you're not an oncologist.
I am not. I am actually an internal medicine physician, trained and board certified here in Arizona. And the Cancer Center wanted to create a more holistic approach to their cancer care. The oncologists were managing the cancer and the diabetes and the high cholesterol, and they thought it would be nice to incorporate an internal medicine aspect to the care. So that's where I come in, and I help coordinate a lot of the background stuff that is not directly your cancer, but it affects your cancer in multiple different ways. And so I work with the Cancer Institute alongside the oncologists, the urology oncologists, to help coordinate that care to provide a more holistic approach to your cancer care.
I love that. You're a doctor, but you're also a patient advocate.
Correct.
What a beautiful role. Let's get to prevention. What is the one habit, easy habit, every day that we could all engage in that might help to reduce our risk of cancer?
All right. So for that question, really right off the shelf, sunscreen. We live in Arizona, lots and lots of sun exposure, especially in the summer, sure. 110 degrees yesterday. Daily application of sunscreen or reapplication if you're going to be outside in the sun for long hours. It won't help prevent all kinds of cancer, but at least it would help prevent the skin cancers, which is something that we're exposed to. Obviously, different cancers have different preventative measures, and some cancers can't even be prevented, but at least on a daily basis, that's what I recommend.
When it comes to prevention, let's talk about some of the screenings, the regular checkups we should all be doing, regardless of whether or not we feel sick, right?
Yes, yes. So for that, I say your annual physical with your primary care physician. If you don't have one, get established with one. In my role, I primarily care for patients who already have cancer and are being seen in the Cancer Institute, but there's multiple primary care offices and family medicine offices across the valley. Have that conversation with your primary care physician. What is my age-appropriate cancer screening? Because it varies based on your age, and they'll get that done for you.
And speaking of age, tell me, what are the appropriate ages for those screenings for some of the most common cancers like colon, breast, and prostate cancers?
All right, so I'll start with the list common, so prostate.
Okay.
There's no specific guideline-directed age for prostate cancer screening. It starts from age 35 and up, and it depends on family history. But that's a conversation between the patient and the provider on checking a level called a PSA, prostate-specific antigen, to determine your risk factors.
Okay.
But it's not guideline recommended for everybody. It just depends on your age and your risk factors.
Got it.
For colon cancers, we start screening at age 45.
Okay.
That also depends on your family history and your risk factors. If you've had a direct family member, a mom, a dad, or a sibling, your screening starts earlier. So that's why those conversations with your primary care doctor are very, very necessary.
And the colonoscopy, is that like a yearly? Should we plan on doing that yearly?
There are multiple screening methods now. Hallelujah, we don't have to drink that liquid for the colonoscopy anymore. You can do the colon fit test. There's a fit test. There's a CT colonography. There's the colonoscopy. Colonoscopy is every 10 years. The CT colonography is every 5, and the fit years is every 3, and depending on your provider.
And then finally, breast cancer.
Breast cancer at age 40, and it can be every year to every 2 years, again, depending on your risk factors and your family history.
Dr. Gina Tazi from the Dignity Health Cancer Institute at St. Joseph's Hospital. Thank you for this important conversation. Really appreciate it, and wishing you good health, my friend.
Wonderful, thank you. And you too, and all your family. Stay warm and wear sunscreen.
There you go.
Yes.
And if you want more information about Dignity Health and the Cancer Institute at St. Joseph's Hospital, we'll put it all right there on your screen.